Today we are going to see convulsion. We are going to see the definition of convulsion. We are going to see the causes of convulsion. We are going to see signs and symptoms of convulsion, and we are going to see the management of convulsion. What is convulsion? So, convulsion is uncontrollable, rapid, involuntary contraction of muscles causing shaking and jerking of the body or a specific body parts due to interruption in the nerve cells or nerve impulses. So convulsion is uncontrollable, rapid, involuntary contraction of muscles causing shaking and jerking of the body or a specific body part due to interruption of the shooting of the nerves impulses. What are the common causes of convulsion? So let's see causes of convulsion. So number one, we have fevers. This is hypopyrexia. The temperature of 38 and above. And then we have epilepsy. Seizures. And then another one, we also have hypoglycemia. Glycemia can cause also convulsion. And then we have also high blood pressure, high blood sugar. Then we also have infection. Any infection that causes fevers can cause convulsion, like severe malaria or cerebral malaria. We have meningitis. We have TB. And then another one is also drug reaction or overdose of drugs can also cause convulsion. We have electrolyte imbalance. What are the signs and symptoms of convulsion? We have DIB, that is difficulty in breathing. We also have uncontrollable body jerking. We also have eye movement only to the side, both left and right. And then also we have foaming in the mouth, on the mouth. And then we have loss of consciousness. Someone will also lose, you can say, loss of awareness. Also have eye rolling, and then also we have only the other white part of the eyes being visible. Also convulsion, you can also see only one leg moving, or one hand moving, or only the finger moving. You can also only see the other part of the mouth, the sideways moving. So those are the signs and symptoms of convulsion. So let's look at the management of convulsion. 1, it is emergency. 2, see that the airway is clear. 3, make sure that the patient is safe. Remove the safety. Remove the danger from the patient, or the patient from the danger. This is safety. See that the patient did not bite the tongue. The patient is if the patient bite the tongue, you use the piece of stick to make the patient to bite, and then make someone to take history. Someone also will take vitals. This is TPR, history, the name, the age, the sex, the causes, and the rest of the thing, and then the complaint. And then what we do, we are going to cannulate the baby and remove sample. So we are going to do RDT, we are going to do BS, we are going to do CBC, we are going to do RBS. Random malaria rapid diagnostic test. We are going to do blood slide for MPs. Then we are going to do complete blood count, and then we are going to do random blood sugar to rule out the cause of convulsion. And then you need to inform doctor. Inform doctor. Meanwhile, waiting, after the cannula is in, you give diazepam. Give diazepam rectally 0.5 milligram per kilogram body weight. Or if rectal diazepam is not there, you give IV diazepam at 0.2 milligram per kilogram body weight, and then the doses should not exceed 3 doses. So if the person convulses again for the first time, you give diazepam, you can repeat, and then if the person convulses again, you can give. But if the person convulses after again, what you do, you need to give phenobarbital now. You should not give diazepam. So if the convulsion persists, give phenobarbital. Phenobarbital loading dose of 10 to 15 milligram per kilogram body weight. And then if phenobarb is not there, you can give phentoin 15 milligram per kilogram body weight. Now doctor will come and order for LP, that is lumbar puncture for CSF analysis, and then we'll ask for urinalysis, ask for chest x-ray or lumbar chest x-ray to rule out also other infection like TB. So if the convulsion persists again, doctor will add another anticonvulsant. And then remember to manage the cause. If the cause is due to fever, you give rectal PCM and you tape it sponge. Our doctor will also order for IV PCM in case IV PCM is there. And then if the cause is hypoglycemia, you treat hypoglycemia. And then you give dextrose. If a child, you give D10%. If it is head injury, you give phentoin, not phenobarbital, not diazepam. So that is all how we can manage. Anyway, then remember to monitor the patient. Very closely. So that is all. In summary, we looked at the definition of convulsion as if it is uncontrollable rapid involuntary contraction of muscles causing shaking or jerking of the body or a specific body part due to interruption of connectivity in the nerves. And then we come to the causes. We have fever, that is hyperpyrexia, temperature of 38 and above, and then epileptic seizures, and then we have hypoglycemia, this is low blood sugar level, and then high blood pressure, high blood sugar level in the body. Then also we have infection like severe malaria, cerebral malaria, meningitis, TB, and then also we have drug reactions, overdose of the drug also, and then we have trauma, that is head injury, and then electrolyte imbalance. So those are the causes. We came to the sign and symptom as if the difficulty in breathing, and then the patient will be uncontrollable jerking, and then eye movement on the other side forming on the mouth, and then loss of awareness. Then we come to the management. As if it's a medical emergency. We work as a team, and then you make sure that the airway is clear, safety of the patients. You remove the patient from danger or the danger from the patient. Someone will take history, take vital, TPR, cannulate the patient to do RDT, MRDT, BS for MP, CBC, and then RBS, and then you inform doctor. Meanwhile, doctor is coming, you give diazepam IV diazepam 0.2 mg per kilogram body weight, and if rectal diazepam is there, you give rectal 0.5 mg per kilogram body weight, and then the dose should not exceed 3 doses. And then you give phenobarbital in case the convulsion persists at the loading dose of 10 to 15 mg per kilogram body weight, and you give phentoin. Then doctor will come and order for LP, urinalysis, chest x-ray, and the rest of the investigation. And then if the patient continues to convulse again, the doctor will come and also add another anticonvulsant depending on its suggestion, and then you need to treat the cause. If the cause is the fever, you can give IV PCM, rectal PCM, and then you need to tape with sponge. If the cause is hypoglycemia, you also treat hypoglycemia with dextrose 10% in children. And then if the patient is having head injury, you need to inform the surgical team and just give phentoin if the child is or the person is convulsing. That is all. Thank you for watching, and see you in the next one.